There's two philosophies in anatomical donation nationally for medical schools. Sometimes the people that have the position that I have, they don't want to sensitize the students. They don't want them to buy into that this was a person that was a friend, father, neighbor, grandparent. They want the students to just view it as a vessel, view it as a tool. I'm from the other side of the street. I expect them to care as much as I do. It's not just a body in front of them. It's a real person, and they should never lose sight of that. Oftentimes I'll refer to the donor as their first patient, but it's also their first instructor.
You know you're one of 8 for this task at hand. Someone, maybe all 7 of them on your table are going to be great friends of yours for the rest of your lives. Trust me, this is my 9th year doing this, and the best friends are developed at Anatomy Lab, and it's the people across from you, so get to know them very well. They're going to be great friends of yours.
What we do is we take the bodies from skin to skeleton, and in doing so, it's a reflection of every single layer. And until their hands are involved in that, and they're learning for the first time, they're at a disadvantage if this isn't given to them as an opportunity. There's a real small percentage of universities nationally that have gone to an electronic format, so that the students are receiving education regarding dissection, but they're doing it on computer laptops, and they're doing it on notebooks. And in doing so, they're not really learning that anatomy because they're not experiencing it. They're not going to have, a systematic body. It's not always going to look the same. Sometimes a coronary artery might just find its way, and it developed during the fetal stages on the back of the heart instead of the front of the heart. And what happens is, when you get into a surgical setting and the doctor's questioning you, and this is the first time you've ever seen a human body opened up and you're cutting through fascia layers, what a disadvantage that is if the only formal education you ever had was an electronic education. I do introduce the job descriptions for them, and some people are like, why do you do that? But if they were an asphalt layer or they were a clerk, it gives them more of an identity. And I think giving these people the utmost respect is the first step they should take in meeting them. At the conclusion of the program, we lower the body ceremoniously into the coffin. All 8 students that worked on these bodies will have a moment of silence, some reflection of their own, and then we'll bring them to the crematorium. And as a courtesy, and I think I'm the only person in the country that really does this, I'll drive the cremains out to the family's home. I'm handing over their loved one again, but it's kind of nice that is the final closure. And when I get these words of remembrance and these cards and letters and emails and telephone calls just saying, I was thinking about you and thank you so much for all you did for us, it makes coming to work so easy.